Doc, I understand there is a silent problem with conjugal rights of couples. Kindly make a clip to educate us on number one, low libido problem, number two, men who finish very fast. Thank you very much for this question. I think it's a very interesting discussion to get into. And before we do, I'd like to say that there is no definitive answer to this question. I cannot say for a fact that if a person chooses Khat, then they're going to experience low libido problem. If a person chooses Khat, then they're going to be one of those men who finish very fast in a sexual activity. And that's because we still don't understand exactly how Khat affects these biological processes. We don't understand for a fact how Khat is going to reduce sexual arousal, or is going to make a person finish very fast in a sexual intercourse or activity. What we do have are many studies that have demonstrated or illustrated a very strong association between chewing Khat and low libido, between chewing Khat and being one of those men who finish very fast. Association, correlations, meaning some people will chew Khat and experience low libido. Other people will chew Khat and not experience low libido. Some people will chew Khat and become one of those men who finish very fast. Others will chew Khat and not become one of those men. We've seen that there's association between Khat and impotence. A person is not able to participate in the reproductive activity, meaning a man is not able to impregnate a woman. And here we're talking about sperm count being reduced. We're talking about sperm motility being reduced, meaning the sperm is not moving as fast as it normally would or should. But these are associations, meaning the people who get affected carry in them some factors, some risk factors, some vulnerability, some weakness in them, such that when those factors are combined with chewing Khat, then it makes them develop the low libido problem. It makes them develop the men who finish very fast. And so it would be important to understand what are these factors that are present in some individuals that predispose them to these problems when they chew Khat. The other part that I would bring into, which is not part of the biological research, is for some people, going to chew Khat is actually a way of hiding their low libido problem, meaning they already had a low libido problem, and now for self-protection, because they don't want their partner to know that, they would go and chew Khat the whole night. So as long as they're away, then the wife can blame the Khats on the problem, but really the reason they're chewing Khat is because they already had a low libido problem. It's because they already had the finishing very fast in a sexual activity problem. And so Khat is being used as a self-protection mechanism. That's another way to look at it. I think those are the things that I would say for now, that what we have so far is a strong correlation, a strong association between chewing Khat, and studies are showing us that it's dose dependent, meaning the more you chew, the higher the risk of low libido problem. The more you chew, the higher the risk of impotence. The more you chew, the higher the risk of other sexual dysfunction problems. And so if anyone has other things to add or contribute, please feel free.